alive. South Carolina hasn't reported its first case of flu yet, but more students are headed back to classrooms, and it's time to make sure you have gotten your flu shot.
Dr. Zellner with Bon Secours joins us live now to talk about staying healthy, and hopefully we all can do that coming up flu season, of course.
Well, kids we know are back in school. We know that's when illnesses really start to spread. So what are you guys seeing right now that's not COVID related?
A lot of upper respiratory infections and allergies. So like the common cold. Common things are common, and they still are even with COVID.
And I'm sure people with some respiratory symptoms may be worried about COVID-19. What would you suggest somebody do if they don't feel well?
So I think that it depends on your symptoms. If you have a mild fever, some body aches, some nausea, vomiting, but are able to eat and drink fluids, you should stay at home and call your primary care doctor and see what they advise. If you are feeling symptoms of chest pain, shortness of breath, you're having persistent nausea and vomiting and weakness, then you should come see me.
And you know, someone thinks they have allergies or a cold. I think a lot of people are so scared right now. They don't really know. I mean, I think this whole summer and early spring, people are just kind of freaked out when people get sick because the first thing in their mind is COVID-19. So, I mean, what do you suggest to parents? They're sending their kids to school, they're coming home, they get sick. When should they really, go see a doctor? Is it any different now with, COVID being a part of this?
It's not. Kids can get COVID, but they don't typically get as sick as adults do. So if they have a fever, if they have a cough, if they have body aches, keep them at home. If parents get sick, it's the same thing. And like I said, if you're feeling short of breath, that's when you should really seek medical care. And always reach out to your primary care doctor. There's very few things that have been good about COVID, but the one good thing is you can do telehealth visits and see your doctor from your own home.
Yeah, such a great option to have. Now, a lot of people may think they don't need a flu shot if they're constantly wearing a mask and social distancing. What would you tell them about getting a flu shot?
The first thing I want to say is the flu shot cannot give you the flu. Certainly a flu shot can make you feel a little achy. You might have a low-grade fever, just like when kids get their vaccines. And that's normal. But a flu shot is going to help protect you and your community from spreading the flu, which flu is also can be a very deadly illness in elderly people. And so we want to keep our whole community safe, and we have a vaccination, and we should get it. I got mine today.
See, lead by example,
Yes.
Dr. Zellner. So a lot of people wonder about flu. I think it's a myth that, it's only here for certain months, but I do know flu's around all year. When do we start seeing, flu cases spike here in South Carolina? I know so far DHEC says there's been no reported flu cases as of yet here at October 1.
Yeah, and we haven't seen any either. It just depends on the season, and I can't predict that. But a lot of times December is when we really start seeing a ramping up of flu. Sometimes we get it a little bit later, January and February. But certainly after the holidays, people are around each other, eating with each other, and that is the time that we start spreading things.
And what about the turnaround time for this between a COVID test and a flu test? So if somebody has to get tested, how would you also administer those tests?
So a flu test and a COVID test are similar in how they are obtained. It's a nasal swab or a nasopharyngeal swab. It's slightly uncomfortable, but it goes away quickly. A flu swab takes about 15 minutes in the hospital to come back. A COVID swab depends on which swab your doctor thinks is appropriate for your symptoms. So we do have some rapid flu swabs, COVID swabs.
All right, Dr. Zellner, we're having some complications.
Patients, especially if they're
Sorry, your mic's cutting out for some reason. I think the wind might be causing some issues with us. But Dr. Zellner, thank you so much. And if you missed any of this interview, we will have it up on our YouTube channel in just a little while, and of course inside our Fox Carolina News app. But again, thanks so much, Dr. Zellner from Bon Secours St. Francis. We really appreciate it.
Great, thank you. Stay healthy.
You too.